Herbal medicine is something else that we've seen gain a lot of popularity over the last few years, and it's probably one of the ones that I feel have grown to feel more comfortable with myself, primarily because we don't see nearly the same list of side effects and risks with herbal medications as we do with some of the other ones I've just mentioned. Black cohosh is a very common one, one that is not FDA approved in this country for hot flashes, but it is approved by the FDA in Germany for hot flashes, and consequently tends to be very commonly used in Western Europe in menopausal women. It comes in all types of forms. There are some natural products, there are some products that are in every drugstore or Kmart or Walmart you might walk into. I've listed the names of a couple of those, Remifemin and Estroven, all use black cohosh, although estrogen has estrogen has some other types of components to it as well. I think it tends to be helpful in mitigating the hot flashes. I try not to sell it as a way of eliminating hot flashes, because I think you're bound to be disappointed if you think it's going to take care of the hot flashes. Soy is another one that's received a lot of press, although I have to say it's one that we've probably become a little bit more cautious about as well. Soy has been demonstrated to have estrogenic-like effects, which means when they put it in a petri dish with other cells of human tissue, we can see that it stimulates the estrogen receptors in those cells. What that translates into mimicking estrogen and mimicking some of the estrogen risks, we just don't know. But that is the greatest concern that we have with the use of soy. In addition to that, the problem is how much soy is necessary for a woman to gain benefit from it. It's thought that approximately 40 milligrams a day of soy is necessary to be able to gain some benefit in mitigating hot flashes. That can be a lot to get into a woman's diet or anyone's diet in the course of a day. And there can be some gastrointestinal discomforts and side effects with using that much soy as well. There are also not a lot of studies that look at how well soy is used and what the risks are. So that right now, it is one of those treatments that we probably, again, learn from Asian cultures. And when we look at how women in Asian cultures handle menopause and hot flashes, they seem, of all ethnic groups, to have the lowest incidence of menopausal symptoms and side effects from menopause. And we've tried to learn from those cultures to see if there's anything differently we can do with our diets. And soy was probably the most common thread that was identified in looking at their culture. I should say, looking at other cultures, we do know that in this country, African Americans seem to have the greatest effect of menopause, side effects from hot flashes in menopause, followed by Hispanics, then Caucasians, and finally Asians. Again, in this country, still having the lowest rate of side effects of any cultural group. Another one we sometimes you'll read about on the internet is a medication that's used to treat seizures and migraine headaches. And it's called Gabapentin. It is not one that's gained a lot of popularity, again, because I think its use in these other areas calls attention to the fact that it is a pretty serious medication to use for just hot flashes. In addition, we do see a pretty extensive side effect profile with this medication. Constipation, nausea, difficult muscle control, tremors, and slurred speech, like that. And there's also very little data on its use for hot flashes, and has no FDA approval for that purpose. Some of the resources I think that you can utilize, the North American Menopause Society is one that is run by a physician who I was fortunate enough to have as a professor in medical school, and he is based in Cleveland, Ohio. Wolf Udian has been recognized as being one of the world's most extensive researchers in menopause. And the North American Menopause Society is the society which he has been president of for many, many years. He is retiring at the end of the year now and will not be directly associated with this organization anymore. But this organization is one that I have to say is reputable in using the resources that we like to use in making our recommendations. The American Menopause Foundation and the National Institutes of Health both have decent websites. That bottom one didn't come out as a website, and can also be used as a resource as well.